What I'm launching sponsors and Zoom and live, yes.
Welcome to the Tomorrow of Healthcare in the Oracle Cloud. A place where disruption is your reality and digital agility is the cost of entry. This is a world that rewards those who embrace bold ideas, fueled by intelligent data. This is a place where healthcare stays focused on caregiving, where health plans, hospitals, and health systems become active enablers, engaging patients as dynamic participants in their own wellness, where every aspect of the business of healthcare is orchestrated for organizations, intelligently automating, reducing human error, freeing you to progress your mission, where healthcare professionals are nurtured, developed, and given real-time feedback to help them better care for others, where operational excellence and people-first experiences meet clinical excellence, where administrators and caregivers work as one, intelligently and proactively gaining the insight to focus services and resources where they have the greatest impact. Take command of the digital age. The future of healthcare in the Oracle Cloud.
Pela família, pelos amigos, pelas férias, pelo futuro, pela sua saúde. Não adie mais o que ficou esquecido. Em 2020, quase 5 milhões de exames clínicos não Covid ficaram por fazer. Pela sua saúde, não adie mais os exames que o ajudam a cuidar de si. Unilabs, há uma química que nos une.
Sometimes it's hard to come home and act as if you didn't just witness something life-changing. Because you did. You were part of a critical moment in someone's life. And it makes me wonder, why is this my choice? Why am I a nurse? I know I can't change the whole world, but I can change it for one person, even if it's only for an hour or two. By being there when it counts.
Global.
Nursing is a process. Assess the patient, implement care plans, get the right people together. Heart rate 115, temperature 38.5, saturation 88. Could it be a surgical site infection?
Get infection parameters, I'll be there in 5.
And technology enables just that. Connect with the colleagues, access and share information, prevent documentation errors, stay by my patient's side. It means I can do a little bit more for my patients.
Hi, Michael. You have problems with your leg? Send him to ICU.
And I get to change their world.
Hang on, guys.
And I just know.
Thank you.
This is what I'm meant to do. That's why I'm a nurse.
Welcome back to the Health Data Forum Global Hybrid Summit. It's really great at having you all back here with us for the Across the World Plenary. And this is, I am sure, one of the most weighted plenaries in our 2 days journey of sharing and shared learning and discovery in health data. I have already here in the auditorium our guest speakers and the moderator for this incredible plenary session. We have already Dr. Raphael Grossman, directly from the United States, in our session here. Lord Nigel Crisp from UK. Good evening, and good afternoon, and good morning, all. And Professor Rajendra Gupta also with us. So it's really, truly a global conversation we are going to have here. It's such a pleasure to have you all here and starting this across the world plenary. So hosting this roundtable is Vanessa Candeias, and she's. We were incredibly lucky to have her with us, and actually appointed Vanessa Candeias the global ambassadress of the Health Data Forum, and she has a wealth of experience in global health and healthcare, managing partnerships and stakeholder management. She's a system thinker. And basically, right now, she holds positions as board member in the Health Financing Institute. She's also a senior director in NDESP, the Hepatitis Fund. And previously, she has been involved as a healthcare specialist in the World Economic Forum, and also a career as a technical officer in the World Health Organization. And from background, she's a public health nutritionist with an amazing career. Vanessa, thank you so much for being hosting a session and introducing our these guest speakers that will, I'm sure, will provide a most weighted session. Also, I see Dr. Vic Bakru from US. So we have a range of guest speakers here. But without further ado, over to you, Vanessa, and I wish you all a great, great session.
Great. Thank you, Paulo. And let me start by thanking you for the invitation to be here today. It's really my pleasure to be moderating this session. And thank you and your team for bringing together such a stellar group of speakers. And I'm particularly delighted to be here because Porto is my own hometown. So I feel like I'm very close to my roots here. So let me start by introducing our panel today, and then we will have about 1 hour to go through the discussion. And this panel is rightly so labeled across the world because we will go from India to the US to Europe to the global perspective here. So our stellar group of panelists includes Lord Nigel Crisp. He's a member of the UK House of Lords and the former CEO of NHS England. Thank you for joining us today, Nigel. We have Dr. Vic Bakru. He's a physician. He's the Chief Medical Officer and the head of Mosaic, part of Circulo Health. Welcome. We have Dr. Raphael Grossman. He's also an MD and internationally recognized surgeon and a disruptive innovator with a focus and passion for the convergence of healthcare and technology. Thank you for joining. Joining us from India, we have Professor Rajendra Gupta, and he's a public policy expert who's been contributing for policy making for over a decade. He's joining us from India. And here with me in the lovely city of Porto, I have, to my right, I have Maria Pertivara. I think I got this right. She's a leading specialist at the Fair Data Economy project with Sitra, the Finnish Innovation Fund. And to my left, I have Dr. Stephen McFeely. He's the Director of Data and Analytics at the World Health Organization. So we're going to get started in just a minute. I want to just set a little bit of the context for the conversation, which I think is very timely. And for those of you who I hope have been following the conversation over the past day and a half, I'm sure you will find this quite a fruitful discussion. And so we know that data science and digital technology can improve human health. We've been seeing that over the past 50 years. We've seen a tremendous acceleration of how technology, the role of technology in human health and the improvements that it can bring. With that, we have also seen that the increased demand for health data has exposed some of the long-standing issues, such as intellectual property rights, data access and data sharing, some around interoperability or cross-border data sharing, some issues around consent, reuse, storage. So as we use more and more data, we need to be mindful of these and find ways to address them. And so if healthcare is to truly leverage the power of data, it is vital that we find and we develop and we agree upon standards. We agree upon safeguards and safe ways for using data and sharing data, and really leverage the full power that data can have in transforming the healthcare systems. And so with today's session, and because we're part of the Orange stream, we're going to keep a bit of a lens on healthcare payers and governments. And really, we want to, with the input from all of our experts, we want to be thinking through how can payers and governments, which, you know, for example, in Europe, governments are some of the largest payers for health, leverage data for decision-making, for sustainability of healthcare systems, and most importantly, for the benefit of patients and populations, because ultimately that's what we want data to be used for, right? It's for the benefit of us all who are ultimately also part of the healthcare system. So, and Nigel, I am looking at you, and you've now heard me use the terms healthcare system and health ecosystem, and I think that's kind of a good segue for you to start our conversation. Your latest book, the title is Health is Made at Home and Hospitals is for Repairs. And I'm very much aligned with this type of thinking, because I do believe that we need to think about health beyond the walls of the hospitals. And so we also know that a lot of the incentives to creating healthier environments, to promoting health, to shift from curative systems to health promoting systems, they're not in place, right? And some of the pathways are not yet there. So where do you see some of the opportunities to change this? How can we leverage the ongoing digital transformation to really promote health outside of the healthcare system context?
Well, thank you very much indeed. I normally start, I'll just make a couple of quick points. But I normally start by taking off my glasses, because I think we need to take off our health system glasses. I take off my NHS glasses or my SNS glasses. I'm not going to talk about government at all. Government gets in the way, even though it's a big payer. This expression, health is made at home, hospitals are for repairs, come from a great African health leader, Francis Omazwa in Uganda, and it's about creating health. It's about health being made. It's about creating health, not about healthcare. It's about the causes of health, not the causes of disease. So it's not about prevention. And when we think about health, I think we need to think of it in three buckets: the wonderful healthcare and health system and all the rest of it, which is so valuable and vital for us; the prevention and protection, which is very largely the responsibility of government, on legislation and regulation; and then creating health, which is the responsibility of everybody else in civil society. Think about health. It's about living life to the full. It's not an add-on to life. It's about social, being in touch with people, relationships, everything else. And actually, creating health, helping people to be healthy is what our parents do. It's what a good school does. They help you to grow up strong, healthy, resilient. And so on. So my focus at the moment is very much on the non-health actors. But of course, we need all these three bits to come together. But let me give you one example where I think data and technology can be really useful to us. And examples I use today are all from the UK, but in fact, there's massive examples around the world. But I'm thinking of an architect's practice in Bradford in the north of England. And architects have enormous impact on our health. in all kinds of ways, and designers and people who run cities and so on. And they have developed a thing, it's called Zeme, actually, Zeme tech, whereby you can basically run a cursor across a map of the city, and in in sort of 10 meters squares, and you can see everything that's happening in that city. So you can see social groups, you can see gardening groups, you can see the schools, you can see all the social activity within it across the place, and you can overlay that with the social determinant, the social perspective, unemployment rates, wealth in those areas, access to green space, and so on. And with this device, you can get a real picture of communities, and you can see where the problems are, you can understand what's there and what's not there, and you can see the opportunities. Now, this is extraordinarily valuable because it's all real time, it's all built up from data that is accessible through different public databases. It's just brought together, and with machine learning, it's been all linked together. So you can get a real picture of what's going on, and that means that if you're a health professional, you can decide where you want to intervene. If you're a city leader or something, you can decide how you want to try and link up some of these things that are happening there. And so on. And if you're a member of the public, actually, you can use this and find out what else is going on and start to help build community. Because actually, my final point, the health of each of us as individuals is intimately linked to the health of our communities and to the health of our society, and ultimately to the health of our planet. And this sort of tool helps us to use that knowledge in an effective way.
Yes, absolutely. Thank you. And do you have an example, or have you seen, in addition to that tool, have you seen some communities where you thought, well, they're doing it, they're getting it right, they're moving in the right direction? Is there any example that you'd like to share with us on that?
Oh, I think there's a lot of places. I mean, there's massive interest in healthy cities now. The mayor of Paris, if I just go outside the UK for a moment, has set up what she calls 15-minute cities. And that within 15 minutes, you should be able to have access to a whole range of things. In some work I'm doing in the UK Parliament, I'm looking at healthy homes and trying to persuade government that all new developments should promote health and safety and well-being. That should be written in, and that means to do with things like access to green space and so on. So I think there's lots of bits of developments that are happening, but it's not yet all completely joined up. But it's the really key thing is we've got to start to recognise that this bit about creating health, about creating social networks. Social networks create health.
Yep.
Good ones.
Yes.
And bad
Yes.
ones may not. But it's all about creating all of that as part of this great big picture of health.
Yes. Yes, absolutely.
Right into the most intimate detail of the medical equipment I can see behind Dr. Raphael at the moment.
Yes, absolutely. And I'm glad you mentioned you're calling out to the health at home, because especially where you have increasingly aging populations, you want to be able to provide for the best care that people need at home, and also to not forget the aspect of social connectedness. And so if people are in supportive communities where care at home can be provided, then the chances that they will remain engaged, that they will remain with high levels of cognitive or without cognitive decline, the chances are much higher. Thank you. Good. So from England, we come to Porto, but in fact, we go with a global lens to you, Stephen. So health is both a strategic asset and a public good, the management of which requires global cooperation and leadership, particularly when we have quite a fragmented global health landscape. And so I am glad that we have the chance to hear from your side, from the World Health Organization, really on how is the WHO addressing some of the gaps that you're seeing internationally in terms of data governance, and how can having a more coherent view of that, how can that then be used for better policies and better solutions?
Okay, thanks, Vanessa, and good afternoon, everybody. Let me begin by saying the statement that you just made, that health data are a public good, I'm not sure that's an uncontested view. I wouldn't disagree, but just to set it in context, and with that in mind, Earlier this year, the World Health Organization held 2 data governance summits to reflect on this very issue. And the outcome, I'm happy to say, was a commitment from WHO that we would safeguard WHO data and statistics as global public goods. And there was large support for that, so I was very happy with that. And what I mean by that is that means the data will be open, but critically there'll be equitable access to everybody. So there's no preferred customers. Implicit in that promise is the recognition that data are assets, and they must be treated as such. And that means they must be treated with respect, they must be stored properly, they must be protected, they must be properly curated, maintained, and updated. But it also means they should be used, and this requires putting in place mechanisms that allow us to move the data and share the data safely. We see like the data world is rapidly developing and fragmenting. So more broadly, the WHO is part of a wider UN system. So we're working with countries and encouraging them to adopt good data governance standards. Importantly as well, the WHO is also part of a UN group that's now working to develop a new global data compact, which will be like a Bill of Rights to deal with data. And the purpose of this Bill of Rights is to set out the principles and mechanisms to try and strike a balance between the individual and the community, and between proprietary data and data as a public good. So these are just some of the actions that the WHO is taking in the kind of governance space.
Thank you, Steve. And if you think of, as you interact with the member states, are there some key principles or steps that are emerging for that governments can take to advance their own national level preparedness to use health data in the most effective way? Are there things that you're starting to see and say, look, no matter how the landscape evolves, these are things that you can always follow?
Yes, there are. In fact, in the context of preparedness, though, it's interesting that there's a saying that generals always fight the last war. And in data, it's no different. The next pandemic, the next emergency is going to be different it's almost inevitable. So the challenge is to try and learn general lessons, but prepare for a broad suite of emergencies, rather than trying to replicate a solution for an emergency that's passed. So firstly, I think what we're trying to do is encourage governments to reflect on the lessons from COVID before they forget, because clearly we weren't ready from this pandemic from a data perspective and many other perspectives. But there's a natural tendency to move on quickly, but it's important to reflect and learn lessons from what's happened. Secondly, we're really trying to encourage governments to take the issue of data seriously. They need to invest time to understand developments in data, in artificial intelligence, and to understand the implications of these developments. So concretely, I would propose, and we're proposing 2 issues. One is organizational, and one is governance. So on the organizational side, we're really trying to encourage governments to think of data as infrastructure. So you've heard this expression, data is the new oil, and I hate this expression, but let's just use it for a moment.
Yep.
Data, like oil, it needs to be collected or harvested, it needs to be cleaned and refined, it needs to be stored, shipped, transported. So like oil, data need infrastructure. They need systems that connect. And critically, from a data perspective, what you really need to encourage governments to think about is unique identifiers and standard classifications. There's a tendency in the health sector to say that they need a unique identifier for the health sector. I would argue differently and say the health sector should adopt the national unique identifiers, because one of the problems with health data that I've seen since I've joined the WHO is health data is quite isolated from economic data, from social data, from environmental data, and it's back to the point that Lord Chris made. If you want to understand public health in the broadest context, you need to be able to get all of those data pieces to speak to each other. So we're encouraging governments to think about how they organize their data. So and again, back to an idea that Lord Crisp just used, we want them to think about data architecture. Good architecture will not happen by accident. They need to think about how they digitize and organize their data so that it's usable. Two concrete examples within this. One is how to organize health information systems so that we can connect with the wider national administrative data systems. Secondly, I mean, an ongoing issue is civil registration and vital statistics. I mean, it's crazy. I mean, this should be a priority for every government that doesn't have births and deaths registrations. 40% of global deaths are still unregistered. It doesn't get any more basic than this. I mean, this is what bookends life. And in fact, one of the denominators that we use for almost every statistic is the population. In many countries, we still don't really know what the population is. So when we talk about, for vaccine coverage, we need 85% of the population. Well, if you don't know the population, it's very hard to know if you've achieved adequate coverage. Then on governance, organizational infrastructure must be supported by strong governance, strong principles and legal infrastructure. And that's to ensure that the data are a public good so that everybody benefits. So there's a variety of ways you can approach this. You can adopt a national code of practice. You can take things like the FAIR principles. You can take the UN fundamental principles of official statistics. There's any number of kind of principles and guidelines you can lean on, but you have to have some sort of governance in place before you can start talking about data sharing, data privacy in a serious way. I would argue too, this must be accompanied by strong national statistical legislation and some sort of data protection legislation. And when I say some sort, I think we need to think beyond GDPR. So GDPR is very much focused on individual. I think though there's a balance to be struck where we can start thinking as well about community data protection as opposed to just individual data protection, because this is one of the big trade-offs that we see around the world is that this trade-off between the individual and the community.
Yep.
And I think maybe putting all the emphasis on individual data protection has been a mistake. Crucially though, to get buy-in to this, we need stakeholder buy-in, and this is challenging because what we want to do is co-create some sort of a governance model, but this requires quite a sophisticated level of data literacy. And I think that's one of the biggest challenges facing governance today.
Yeah, I agree. Thank you, Stephen. I very much agree. And when you look at the diversity of healthcare systems that we have, whilst in Europe you may have the government taking the lead and therefore might be slightly less complex in terms of organizing governance. When you look at Middle East, India, you have such a wide range of private sector companies that how do you bring them all to the same table to have a governance that makes sense for the healthcare system that you're creating? It can be very challenging. Thank you. So from WHO, we're going to go to India. So Professor Gupta, Rajendra, you've recently put out your book called Digital Health, Truly Transformational, and you did this survey across 127 countries, analyzing their ability to use digital health at different levels. So can you tell us a little bit about the concept of the digital health quotient and some of the differences that you've seen across countries and in their health ecosystems?
Thank you, Vanessa. Firstly, great pleasure to connect with you after a decade at World Economic Forum, and my salute to Lord Nigel Crisp, who has been an inspiration all through this quarter of a century. Feel honored at this forum and hearing all those views. So when I started this digital health book, got inspiration from Lord Nigel's book, You Have 24 Hours to Save NHS. And I wanted to understand, like all of us are into digital health. I have seen this journey, when we started talking about health, it's what's called, health informatics. Then it became telemedicine, e-health. Then it became m-health. then it became whatnot, and finally we all agreed, even at WHO being a part of the guidelines group, we finally agreed to kind of accept unanimously the word digital health. So it has become much broad. So digital health encapsulates everything that we talk about using technology in healthcare. That's first. So it includes your remote consultations, your referrals, discussions between doctors. It includes artificial intelligence, machine learning, robotics, everything under the sun where technology comes in. That's digital health. So when I was writing this book, I said, okay, so it's like a 600 pager, on health across the world, across specialities, across professions in health. So what I wanted to check was how much do people understand digital health? So I bought this concept of digital health quotient. So when you start this book, you have a set of, I guess, 20-25 questions which you answer and check. Okay, so where's my digital health quotient? How much do I understand digital health? And that is something that I kind of developed. And when you complete the book, you again take a test to find your digital health quotient after you've read the book. So you get to see whether did I improve or not, because all of us, and this is such an evolving field, Vanessa, like no one can call an expert in digital health. So what we talk today will be a little different in a years from time. It's like going to change. So that's where it is. And sorry, what's the next question which I can attempt to
So
use?
can you, thank you. I think that's very helpful. And can you tell us a bit some of the key do's and don'ts for the digital health space? I know that you've gone a little bit into detail about that. Can you share some of those with us?
Yeah, Vanessa. And before that, you touched upon the 127 nation survey. So I also wanted to make sure that, during COVID, we had seen a big shift. I remember 2010, someone told me in a GSMA forum that Rajan, this is a gimmick. It will not fly. Why do you invest so much time, efforts in this? I think we all have come a long way. Last 2 years have been a savior thanks to digital health. So from a gimmick to an essential thing in health, it's a reality now. And I decided that let me do a primary study to check where do we stand with regard to digital health. So I did a similar study in 2014. So in 7 years, what we saw was a big shift, close to around between 4 and 10% in different parts of the world 6-7 years ago. It's 81% now. Unimaginable. I think if there was no digital health, we could have lost much more lives.
Yeah.
Much more lives. Today, thanks to governments opening up their rules, regulations, freeing a lot of things that actually became artificial barriers to digital health, which led to mass adoption. Now, my worry is, and which has come out in this study, I did two studies. One was 127 nations in the peak of first wave. I did another study with 38 nations around the when the COVID first wave was receding to get a sense like where do we go from here? 19.3% people who were surveyed said we will go back face-to-face consultations. Now take that 19.3% and 11% who never practice. Effectively, my challenge rests there. So these 30% of the people who will not practice. Now, digital health is about an ecosystem. If all those clinicians on the frame, I am a patient, I go to hypothetically Lord Nigel Crisp and he treats me and gives me a digital EHR, says, Raj, here's the test and go ahead. I go back to some other doctor and say, I have a digital record. And he says, what? I don't still use that. So the purpose of digital health will be defeated. I think a forum like this, where people are watching from the globe, we need to make sure that it is ecosystem driven. These 30% and those fence sitters also need to come on board. What is the minimum governance which is needed to get that? I think that is where forums like these, leaders like Lord Nigel, and also multilateral bodies like WHO also need to go beyond WHO and talk to WTO. The only one meeting which I have attended together, World Trade Organization and World Health Organization. If these people start collaborating, whereas one side it's a public good, it's also a strategic private sector interest. We cannot, close our eyes to that reality. And as long as it gets into business, it gets into scale. That is what exactly we need today. So I think for me, my takeaway after all these studies and being a part of this forum says we need to get private sector involved, but there has to be a framework, what they do, how they do. Let's not over regulate, it will kill innovation. But let's balance because it's about saving lives and not killing businesses. Thank you.
Thank you, Rajender. No, that's very good points that you make there, and hopefully we won't go back, because what we have seen was such a tremendous progress in terms of the digital using digital tools for consultations that have benefited people. So I hope we don't, particularly in places where access is difficult. And so we'll travel from India to the US. Vic, I will put you on the spot here, and I think it's a very good segue, because in countries with the makeup that the US has, then payers and providers can do a lot to really shape the demand from the consumers, or to respond from what they're seeing in terms of demand. So, some of the technologies that have been used, they've operated in silos. They've been using different frameworks, different standards, storing information in ways that, systems cannot understand. Some systems don't talk to each other. And what ends up happening is that access to health or to the services gets reduced. So can you share with us how you're using technology to actually increase access to care by really going to the heart, and I'm making this sign here, to the heart of the question, by revolutionizing what billing looks like for providers? Can you tell us a bit of how you're going about it?
Yes, absolutely. First and foremost, however, thank you so much for this opportunity to join such an esteemed panel, and major kudos to you, Vanessa, Paul, and every person behind the scenes, from audio, video to event planning to every other person who is involved in producing such a wonderful conference, as Health Data Forum. My hope is that next year or in future years, I'm able to join you all in person, whether in Porto or elsewhere. But I myself am actually under the weather right now, so forgive the rather raspy, froggy sounding voice. Second, please allow me to, similarly in honor of Lord Crisp and his demonstration, remove my glasses so that we may all look with an authentic view. However, I am not able to see your smiles and, more importantly, your frowns without them on. So forgive me for placing my glasses now. And third, in answer of your question, Vanessa, please let me get to it. As many know, in the United States, we have a multitude of health insurance companies. Roughly 9-10% of the population does not have insurance, but the remainder has insurance, whether through a government-supported facility or whether through a private insurance facility. Roughly 330 million people in the country. Roughly half of those receive their insurance through their employer. So as their work, they receive some form of support for their health insurance. Another 130 million or so receive support from one of two major government programs: Medicaid, covering the underserved and those whose income levels fall below the federal poverty level or very close to it. Some states have provisions that allow 120, 130% of the federal poverty level to qualify for the Medicaid insurance program. The other government-funded, the main government-funded program is Medicare. Medicare is largely for senior citizens, those over the age of 65. Now, with that premise, and then of course there's another program, an exchange program, where people can self-purchase insurance should they not fall into one of the categories of being employed, falling under the income level, or being a senior citizen, or having a specific disability of sorts. So with all of that context, the company that I work at, Circulo Health, is a new Medicaid insurance company. And one of the biggest challenges in Medicaid is that the fees paid to clinicians, as you might expect from a program that covers approximately 1 in 4, 1 in 5 American citizens, the funding is not enough to meet the needs of the population. And as such, the payments to clinicians for services provided are lower as compared to some of the other insurance programs, Medicare, or what we call commercial insurance, that insurance received through employers. Typically, commercial insurance might be double or even triple what the Medicaid payment rates are. So if you go for a consultation or a procedure and you are covered by Medicaid, the payment to the clinician is substantially lower. Now, understanding that it's lower, it attracts fewer clinicians who want to participate in the program. And this creates a dynamic where those fewer physicians and nurses and clinicians who are participating in the program when they do the hard work of delivering care to a population that has quite a bit of need. And then they not only see the patient and they document a clinical note, but then they have to fill a form to get paid. That form is then often rejected. And this results in a really disastrous cadence between clinicians who are doing the good work and insurance companies that are, in some cases, managing cash flow by denying the claim form submitted, or a whole host of other considerations like detecting fraud, waste, and abuse, which is an important consideration that we ought to have a process to address. The question is, what's the right process? And so Circulo is building technology that allows a few things to be different in our health ecosystem. First, we are eliminating the need for asking permission. We do not believe in something called prior authorizations. Prior authorizations is when a clinician must submit a form to ask permission to deliver care to the patient that is in the best interest of the patient's needs. And when you have that type of a process, it delays care and can worsen states and actually discourages, in many cases, the delivery of that care. And so prior auths actually serves to manage cash flow, not the patient's needs. And we believe that we can establish a system that can detect fraud, waste, and abuse using a knowledge graph and data analytics, as opposed to a forms process that 99.9% of do-gooders must be put through, and it results in abrasion and frustration between the clinician and the insurance company. Number two, we want to accelerate the payment timeline. Another large insurance company in the United States, Anthem, recently came under fire in the state of Virginia with one of the health systems for having $385 million not being paid in the timeline that it was supposed to be paid. And so naturally, the health system has now filed a lawsuit against the insurance company. And again, it results in quite a lot of frustration. And most importantly, distraction from what we are all here to do, which is serve the needs of the patient, the person, the individual. And so we believe that battle's over. We will do the dishes. Let us fill the claims form. Let us do the submission and the figuring out of the data elements, but the clinician should focus on doing what they do best, which is serving the needs of patients and people. And we can do the administrative, we can cover the administrative hassles through technology. And so just to sum up, these are the ways: remove the asking for permission, use data analytics more appropriately, and bring really modernization to some of the transactional nature in healthcare. 30 billion transactions in the US per year in healthcare. 15 billion of those transactions are handled through a fax machine. In a day and age when I can call a taxi to my door using an app, thanks to the likes of Uber and Lyft and Ula and so many others around the world, whose names I'm likely forgetting in this very moment, we should be able to make payments more efficiently. We should be able to serve the needs of patients and people more seamlessly. And we should be able to bring more technology to a system that has really functioned off of decades old infrastructure.
Yeah, for sure. Thank you. The physicians that work with Circulo must love you for taking some of the paper workload off their desks. I have just one more question for you, Vic. Could you see some of this Circulo's tech and approach being used in other countries or with other healthcare systems? Would you see it be exported to other settings?
It's a really great question. And this problem that I described exists in different ways in different places. And much like humans and their adaptability in different environments to be able to adapt to their environment, to be able to accommodate their needs in a range of environments, really. Similarly, technology, when built correctly, when architected correctly, there was a reference earlier to the architecture that must be considered. I think it was Stephen. Much of the algorithms, the machine learning, it relies on the data points, the data elements that are inputted. And there's a process by which we can configure it correctly. Much like when you build a road, you may have many different types of cars, mostly with 4 wheels, some with 2, perhaps some would 3. But generally speaking, the construct of vehicles on the road remains largely similar, but they're different. They're unique, different brands, different capabilities, different features. Similarly, the technology that we are building is the platform. It's the roadway. We believe that through the use of the needs of a particular environment, the data elements available in that environment, and the use cases that we can configure against, the platform can absolutely be used in other settings. We haven't really sorted that out yet. I should note we're 6-7 months old. This is a lot of vision, my friends. Yes.
Yes, for sure. So good luck. I hope that we will see some steps in the direction of seeing Circle's approach in other settings as well soon. Thank you. We'll remain in the US and go to you, Rafael. So we talk about the great progress we see every day in hospitals, in clinics, with amazing tech being used to improve health, save lives, ensure sustainability of healthcare system. Question to you is is the training and education of medical doctors and healthcare workers in general keeping up with the pace of innovation? And how would you transform healthcare and medical education if you think it needs to be transformed?
Hello there. It's also a pleasure to be here, an honor to be here, and congratulations for such an amazing event in these difficult times. Well, the answer to the first question is no. I don't think that we are anywhere close to where we should be in the 21st century in regards to how we educate the current and the next generation of providers, of medical providers. Let's not just talk physicians, but talk nurses, talk physician assistants, talk basic healthcare providers, which is really what the world needs more than doctors, I would say. We are very, very far from that. And I think that really we sometimes focus on the wrong targets. I think, I'm a surgeon. I'm a full-time surgeon. I'm a general and a trauma surgeon. I'm in the trenches, I guess, in parallel to trying to also be a full-time digital health dreamer, maybe is the right word. For many years, my passion has lied in how do we use the almost magical technologies that we have in the 21st century and in the later years of the 20th century to really improve how we connect and how we communicate and how we teach and how we diagnose and how we regain health. And back almost 12 years ago, when the iPod Touch came out with FaceTime, then we thought, why don't we use this little device that is $200 to connect to rural areas. I'm not talking rural areas in Latin America or Africa. I'm talking rural areas in the US, which are as bad, some of them, as some of those areas in other continents. And how do why not do that instead of using a fancy telemedicine, telehealth tower that costs $100,000? And so it is about using the technology in a smart way. And I think that it requires a little bit of a shift in how we look at the whole ecosystem. And the most basic technologies that were created for entertainment, for taking pictures of your cats and that sort of thing, those same technologies can we use to connect and communicate better with providers, among patients, among providers, to empower us to do better health care, which is not healthcare what we do, as you rightly at the beginning noted. What we do is sick care. We barely do any healthcare. So yeah.
And if you think of some of the things that need to be changing, how would you see the role of government and we as a collective health community? How could we enable and accelerate this transformation? And I know that, for example, for the past two years with COVID, we've seen a lot of these digital transformation accelerate pace. How would you like to see some of this acceleration continuing, particularly if you think of the training of the medical profession? What would you like governments to be doing to help that?
Well, I think that that's a vital step, right? One of the pillars of how we do this, and the regulators need to be on board. And you see how in the last few years, especially, I can talk about the U.S., which is really where I've lived and trained for many years. The role of government has been vital, right? And the pandemic only accelerated this, but this was happening even before the pandemic. How you were seeing a next generation of let's talk about the FDA, for example, next generation of regulators, right? That were out there, that were thinking, maybe with a younger mind, thinking, how do we use these technologies to empower the physicians, the providers? And you see something like the Digital Health Center of Excellence that the FDA created under Dr. Bakul Patel and other initiatives accelerating the use of telemedicine, accelerating the rupturing barriers, geographical barriers, federal barriers in the U.S. in order to accelerate how telehealth is reimbursed, for example. All those little details are really vital in order to have these technologies be really part of the daily way we connect and communicate with patients and among providers. So their role is vital to anything that we are planning to achieve. And not just that's just one pillar. I think that the government, the changing the culture and educating the actual providers, which is what was meetings like this do, changing the mind of patients who are reticent to engage with a screen, and then once we do engage them with the screen, then they love it because they don't have to spend 2 hours getting to the doctor and then sitting in the waiting room for an hour to see us for 5 minutes. So I think that is many factors to be addressed.
For sure, thank you. And so from the US, we're going to travel back to Europe, to Finland and to Europe. Maria, can you share with us some of the current barriers and challenges that you've seen faced in the European space for sharing some of the data, some of the health data, and how are you addressing those? Because I know that there's quite an innovative project put in place to help address those. So, Maria, over to you. Can we please bring up the slides from Maria?
Yeah. The
Oh,
slides.
they're here and they're here. Do you?
Yeah. Thank you. Yeah. First, I'm so happy to be here, and my congratulations and full respect to Portugal when you have been so successful with Corona. Sorry. Yeah, I have to take this. Yes. First, my congratulations and full respect to Portugal when you have been so good at solving this corona problem and getting people vaccinated and using masks. It's really something special, world top class situation. And then about health. What does this health mean? In practice, is combination of genome, environment, and your own actions, your own deeds. What your own selections, including medication, what medication you will use. And then there are coincidences. How to understand this kind of combination and how to make it function in the best possible way. So I think one of the most important issues is trust. Like in Portugal, you have been able to create trust between people, citizens, patients, professionals, government, business, and we are seeing the results. In Finland, at Sitra, we have a theme, fair data economy, which is human-driven fair data economy, and this kind of European values, which we want to share with others and cooperate with different partners. And I will tell something about the futures of work and competencies, what it means. This kind of, when Sitra is think and do and connect, thank, an organization for future. So I look this problem and everything from these classes, as classes of future.
megatrends here in healthcare it affects. It is we have this ecological issues or sustainability, economic sustainability. Then we have population, aging population, and all kind of networks of nations, hospitals, research organizations, which are nowadays more important than ever. And the economy everywhere is seeking directions and seeking new ways of being able to focus or use the resources in the right way. And technology is here embedded in everything. Then what kind of skills are needed? It was mentioned before this, the importance of skills. And as Vanessa said at the beginning, that there is the power of data. It's more important than ever in these trends of this decade. And the quality of data. It is important. We have artificial intelligence, machine learning, and all new technologies. And if the quality of data is not so good, then it can guide us to wrong directions, and we will make wrong decisions. And how to understand this and how to affect this when the actions of professionals, the actions of citizens, all of them affect what is the quality of data. And that brings us to the skills we need in the future, what we have to train, educate ourselves, lifelong learning all the time. So it is this kind of analytical thinking, perhaps, and active learning all the time. It's and also understanding that this problem solving, it is so complex, and we have to combine new issues there and see different aspects in a creative, original way, perhaps, and leading governance of all these systems. So this is quite a big challenge, and how to keep resilience in this kind of situation, peace of mind. And like with data and analytical thinking, it is not enough if you just think about the hard facts and think that, okay, I will show you the facts and then you will know what to do. But it is also explainability of artificial intelligence, that professionals have to understand why artificial intelligence is giving some suggestions or diagnosis whatsoever. If they don't understand, then they will use their own old routes and give old diagnoses, perhaps. And also citizens, patients, if they are not explained well enough what it means and how this result has been created, so they won't take the medication. They will take the medication from the old lady in the neighborhood, and that's not so good, perhaps. And coronavirus, it has really changed the game in a way. Perhaps it was not a surprise. Something like that might have happened sooner or later. And now we have to learn to live with this situation, and certain changes, they may be amplified now and then, and there might be new trends. And again, we see the importance of trust between people, and also the meaning of sharing information and data to make research, create new innovations. And this has been amazing to see how much information and data is shared. And this conference is a good example that this is truly a global conference. Wonderful to hear examples from Brazil and other countries, because very easily we have fortress of our own country and we think that we can solve all the problems alone. But it's not so. More than ever, we are very international. In an international situation, and international cooperation is important. And that brings us to the accelerating of the transformation, which this transformation is something we need. I want to give you an overview of the European Union actions. It's about data-related actions, not just health data, because we have got GDPR. It has been affected everywhere where we use data. And nowadays, data is combined. It can be from primary use of healthcare, what is about patients, and then it is reused in secondary use of research, and people give their own data for doctors tell what they have collected, like Oura Ring. I have my Oura Ring in my finger. I know my sleeping habits. But there are quite a lot of acts at the European Union level. Our health systems, they are national. We are not harmonizing the European Union totally so that every country should have the same system. But there are things that have to be harmonized. Some of them come from these data issues. And also there are Open Data Directive, Digital Strategy, Data Governance Act, Digital Compass, Artificial Intelligence Act, Digital Services Act, Digital Markets Act, Data Act, and so on, all the time coming new things, and about European health data spaces as well. So it's not so easy to draw this kind of overall picture. I wanted to share that with you. We have been speaking a lot about regulation here and rules of the game and standards. And when it is the question of trust, for example, it is not just regulations. And as regulation defines the ethical minimum and personal ethics defines its maximum, because it's anyway personal decisions you make and how you treat other persons, how you treat patients. So these are difficult questions, and how to bring a person in front.
Can we hear you?
Yeah.
Yeah.
Can you hear now? Yeah, thank you. Something happened. I don't know. So it is this kind of good to think about the ethics of these decisions of every person and every nation. And about cooperation, this is also this kind of big picture of possible European Union financing programs and instruments like grants, loans, guarantees, investment funds whatsoever. I come from this financing side. Our organization is financing projects as well. So there are about 30 of them, and they have their different styles, and you have to apply money. But people are learning to cooperate, and it is not just within the European Union. We have this TEHDAS project towards the European health data space, 25 countries in Europe, not just European Union countries, but we have started this kind of nearly 3 years project, and CITRA, my organization, is coordinating that. We are creating the rules of the game, and especially for secondary use of health data. There are things like data quality, which I started with that, governance and sustainability, economic sustainability, data altruism, how people can donate their blood and health data, for example, for biobanks, and how to engage citizens, and what is the infrastructure, and also regulation needed here. We have this week a meeting in Helsinki with these 25 countries of Europe. 2 days, it was amazing the same to see people in atoms, not just in bits. I'm a physicist. So some thoughts from TEHDAS meeting in Helsinki, which was Tuesday and Wednesday this week. And it's again there in those discussions, you can feel or how important a human being is, that we have to get a human being in front and in the center from the very beginning of healthcare and processes. And this patient-focused development, both in governance and architecture. We have been speaking a lot about governance and architecture during these days. And how about real empowerment of patients? Not just being sensitive about how they might feel, but really empowerment of them and cooperating with them, listening. They should be actively involved, and then they are also ready for sharing their data, like this data altruism, which we see with this corona research has been quite important. I was the first person in Finland to get a copy of my biobanking DNA data when I was analyzed. After 2 years, I got a copy because I made this kind of request based on GDPR that please give my copy to me, and I was given, and they were perhaps happy that it was me when they knew me there at Helsinki Biobank, and it was nice. And that's a future in every country, that people have to feel that they have been they are participating in research. So this was my ideas and about the future of healthcare and data sharing. Thank you.
Thank you, Maria. And I think you've touched on a number of questions that hopefully, ideally, we would have 1 hour session for each one of them. But, time will not permit for that. And I am Portuguese, I am from Porto, but I've been living in Switzerland for 18 years, so I'm very mindful of the time. What I would like to do to wrap up is to have all the speakers answer the same question. So if there was one thing that you could change today to build a better, more sustainable healthcare system, what would that element be that you would change? And this is like a 30-second type of answer. So Nigel, I would start with you first. What would you change today?
Well, I'm actually, I think, with Raphael on this, professional education. Very quickly, digital health has two meanings, only one's to do with technology, the other's to do with one's digits.
Yes.
And it's what people do count, and what happens in here is what counts.
For sure. Thank you. Stephen, what would you change?
Well, I'm a statistician, so I think, as I said, I would like to really focus on the improvement of basic health information systems around the world.
Thank you. Vic, Rajendra, let me go first to India. We do the same clock that we did the last time. Rajendra, over to you. What would you change?
Thanks, Vanessa. So first thing is move technical interoperability to human interoperability. First is meeting our minds. And the second is that we have a 3-tiered healthcare system, primary, secondary, tertiary. I would recommend a 4-tiered system where digital health comes at the base, which integrates across the continuum of care. Thank you.
Great, thank you. Yes, Vic, over to you now. What would you change today?
Thank you so much. My answer will be fairly simple. It is health is a human right, and healthcare ought to therefore as well be a human right, just as food, shelter, clothing, the basics for life should be available to all, anywhere. People should be able to walk in and receive the care that they need. If they receive a cancer diagnosis, they should receive the best-in-class treatment. I am not the economist at the table, I am the physician. And so my goal is that each person should achieve their best possible health. And so that's what I would change.
Thank you. Raphael, what would you change?
Well, I'm always about education, which happens when we connect and communicate better. So I would change the access to infrastructure, internet infrastructure. If we have that, we then empower education, connectivity, the provision of health care and true health care, not sick care, but the maintenance of health and regaining of health when that doesn't happen. So for me, from electricity to access to internet, that really empowers everything else.
Yes, Thank you. And really, it's bringing us back to the beginning. All of those are outside of the traditional healthcare system. So really bringing it full circle. Maria, what would you change?
Yeah, I would change this data sharing in a human-centric way, and I think this European health data space is extremely important, and I hope that others, not just the project partners, but also others will utilize it. Thank you.
Thank you. And so we're on top of the hour. And so all that is left for me to say is to thank everyone who joined us here, who joined us online, all of our speakers. Thank you for sharing your brain power with us, and keep up the good work, because we all want to have better health and more access to health in the years to come. Thank you, everyone.
Good. Bye.